Hi all, let's study the applied anatomy of the hip and the knee joint. I'm Dr. Komlayan, Professor, Department of Anatomy, Ramaya Medical College. All images and videos used in this presentation are from the textbooks of anatomy and various internet resources. The images are used only for the teaching learning activities. The video is done to help the undergraduates understand the clinical anatomy. I acknowledge the ownership of the images and give complete credit to them. Let's study the clinical anatomy of the hip joint. Hip joint is a ball and socket variety of joint formed by the head of the femur and the acetabulum of the hip bone. This is the ligament of femur holding the joint together. Anteriorly, the joint is stabilized by iliofemoral ligament and the pubofemoral ligament. Posteriorly, the ischiofemoral ligament supports the joint. Let's talk about the clinical anatomy. This is a case of coxa vara. Coxa vara, you can see here. It's a condition in which the neck shaft angle is reduced. It's due to the congenital defect in the ossification of the femoral neck. It also can be due to pathological cause such as rickets. This picture shows coxa valga, where the neck shaft angle of the femur is increased. Next, we shall discuss about the femoral fractures. In this picture, you can see the fracture of the neck of the femur. It's called as transcervical fracture. This is at the intertrochanteric area, fracture at the intertrochanteric area, and this is the fracture at the spiral line. This image shows a medial subcapital femoral fracture of the neck, medial transcervical neck fracture of the femur. This is a lateral femoral neck fracture. This is a picture of the trochanteric bursitis. This is the trochanteric bursa which is inflamed. Inflammation of the trochanteric bursa may result from repetitive actions such as climbing while carrying heavy objects. The gluteus maximus moves back and forth over this bursa, leading to the inflammation. Hip osteoarthritis is caused due to erosion of the articular cartilage, results in pain, edema, and limited movements at the joint. This picture shows the fracture at the acetabulum. This picture is showing dislocated epiphysis of the femoral head. In children and adolescents in the age group of 10 to 17, the epiphysis of the femoral head may slip away from the femoral neck because of the weakened epiphyseal plate. Such cases, there can be injury to the artery to the femoral neck. This can also lead to avascular necrosis. Referred pain from the hip joint. The hip joint is supplied by the femoral nerve. Femoral nerve also supplies the front of the thigh. Obturator nerve, the branches supply both the hip as well as the knee. Hence, any pathology of the hip can also radiate to the thigh and the knee. This is known as referred pain from the hip joint. This image shows the fracture of the greater trochanter. To determine the fracture of the greater trochanter, there is a test involving the Briand's triangle. So this is the Briand's triangle. The patient is in the supine position. The first line is drawn from the anterior superior iliac spine to the bed. The second line is drawn from the tip of the greater trochanter to join to the first line at right angles. And this is the hypotenuse drawn from the anterior superior iliac spine till the tip of the greater trochanter. Any disruption of this triangle will indicate the fracture of this greater trochanter or displacement of the greater trochanter. This shows the Trendelenburg's test or the Trendelenburg sign. Normally when the body is supported on one limb, the glutei of the supported side raises the opposite or the unsupported side of the pelvis. But if the abductor mechanism is lost due to the weak gluteus medius, the unsupported side of the pelvis drops. This is called as positive Trendelenburg's test. This results in waddling gait. This is a slide of Perthes disease. In Perthes disease, there is a disorder where the blood supply to the femoral head is compromised or temporarily disrupted. This causes the bone death, that is avascular necrosis, and flattening of the head of the femur. This eventually leads to pain, limping, and the limited motion of the hip. Let's study the clinical anatomy of knee joint. Knee joint is a compound variety of synovial joint. It's a diarthrotic joint because it allows movement in two axes. Bones involved in the joint are the condyles of the femur, the patella, and the condyles of the tibia. The ligaments of the joint is the fibrous capsule, the ligamentum patellae, the tibial collateral ligament, the fibular collateral ligament, the cruciate ligaments, the menisci. This is the anterior cruciate ligament. This is the lateral meniscus, medial meniscus. This is the posterior cruciate ligament, and this oblique popliteal ligament. These are the ligaments supporting the joint. There are bursas around the joint. This is a subcutaneous prepatellar bursa. This is the subcutaneous infrapatellar bursa, the deep infrapatellar bursa, and the suprapatellar bursa. Here is a case of genu valgum. It's called as knock knee. Here the knees touch one another when the legs are straightened. It's known as knock knee. Common in children of 2 to 3 years of age. This is a case of genu varum, where there is outward bowing of the legs, and hence it's called as bow-leggedness. Common causes could be infections, tumors, rickets. These conditions affect the growth of the bones, leading to genu varum. This image is a bilateral genu varum, and here there is only a unilateral genu varum. This image is of a healthy knee joint, and here you can see the hypertrophy, spurring of bone, erosion of cartilage due to inflammation and osteoarthritis. Inflammation of the bursa is called as bursitis. Bursa are fluid-filled sacs to avoid friction during the movement. You can see the inflammation of the bursa causing the bursitis. This is prepatellar bursitis, commonly called as housemaid's knee. The maid uses this bursa frequently and there is friction over this bursa during mopping. Hence it's called as housemaid's knee. The other causes could be the osteoarthritis, pseudo gout or any inflammation or infections. So prepatellar bursa inflammation is called as, or the prepatellar bursitis is called as housemaid's knee. Similarly, the infrapatellar bursitis is called as clergyman's knee because the Pope uses it during the prayers. Other bursa which can get inflamed is the anserin bursa. So treatment to all this is application of the eyes, rest and anti-inflammatory drugs. Sprain is stretched or torn ligament. Strain is partially or completely torn muscle or the tendon. It is usually caused when the tendon is overused. There will be pain or tenderness while walking, bending or lifting the leg. The menisci, that's the medial and the lateral menisci, can get injured. They can cause tenderness, tightness, swelling, inflammation around the knee. These are the menisci which can get torn during injuries. Fractures and dislocations of the bones forming the knee joint are common. A fracture is a cracked, broken or shattered bone. Patellar dislocation can happen. Usually there will be an abnormal bulge on the side of the knee whenever there is a fracture and the patient may be unable to walk. Cartilage injuries are common. The cartilage softens and breaks off from the end of the bone, causing long-term knee pain. This is called as osteochondritis dissecans. There can be stiffness, catching or popping sensations with knee movements. Wearing a cast for a couple of months can solve the injury. Knee replacement, it's also known as knee arthroplasty. It's a common procedure done to relieve pain and disability due to degenerated osteoarthritis. It is done by replacing the diseased painful joint by a metallic or plastic component. This allows the free movement of the joint after repair. This is a total knee replacement image done using the prosthesis. During the knee injuries, to test the ACL, the anterior drawer test and the Latchman test are used. In the anterior drawer test, the tibia is pulled forwards to check for any excessive movements. The posterior cruciate ligament integrity is tested by using the posterior sag sign and the posterior drawer test. Here the tibia is pushed backwards. In case of the ligament tear, there will be excessive movements leading to positive drawer sign. Thank you for your patient hearing.